It's okay. Hey, Dr. Brooks.
How are you?
Good. How are you?
I'm doing all right. Plugging
Yeah.
right along.
Good. Okay, let me do. Oh, there's other Dr. Brooks.
You're muted.
But
I'm
I'm
out.
not.
It's the best thing to say on Zoom. Emily, people in Colorado are more excited about you coming than me.
That's not true at all.
People are very excited about you coming.
Oh,
I'm more
that's
excited
nice.
about you going than she's going. Just
You have good reason to.
I am biased.
How is the
Hey,
weather there? Is it feel the same? Oh, I guess you're in St. George. Never mind.
Yeah,
me?
Ben's in St. George.
I'm in St. George, yes. The weather is, as always,
Beautiful.
yes, it's great.
Hi, Dr. Zapata.
Hi guys, how you doing?
Good.
Pretty good.
I suppose Parker's pretty nice these days too.
It's nice here. It was cold this morning.
You need a jacket, actually?
Yeah, Emily, bring a jacket.
Hey.
It's in the high 30s in the morning.
Oh, wow. Okay.
Emily, you're gonna freeze. Bring warm clothes.
No short sleeves, huh?
Yeah. I'm surprised Goobler's not on here yet.
Oh,
Hey,
you
he's
guys just came from dinner, right?
Yeah, I'm gonna go find him. Give me just a second and I'll
he's
get
being
him
a
on.
slacker.
We just had a leadership dinner and they
Oh,
actually brought it in. So
you should probably stop recording for a minute. Otherwise, we're gonna
that's Emily. You must
I
be,
haven't started. Did you get a notification saying it was though?
I have it
yeah,
as recording.
it's
It says at
recording
Oh,
the
right
top,
then it's just IT has it set to record. And I don't stop or stop it or start or stop it, I don't think.
Well, then I better make sure Dean watches to make sure that the burns are appropriate.
I know we can edit at the end. We can
Well,
say cut
let's
off.
do this. We'll cut out the burns to Dean, and then we'll send them to him, and then you can post the other stuff
Okay.
just directly.
Dr. Brooks or Amanda Brooks, are you moderating this?
Great. I'm gonna go see if I can find it. I'm not muted. Stop behaving.
She's not muted, but we had no idea what she said.
Meredith, how are you?
I'm good, thanks. How are you?
I just wanted to say hi because you were sitting there.
Yeah, hi, I'm a little early.
Well, that just means you're excited.
Yes, for sure.
Now I'm really curious. Mary, what is an otter pilot? Does Cassandra have the same thing? Cassandra has the same thing. What is this? Top secret, apparently.
Need to know basis. just turned 6, but we'll give another minute or two for our few last panelists to join.
Is Dr. Linger one of the panelists?
No, I don't. It's
Should be.
you, Dr. Gubler, Dr. Zapata, and Dr. Ross. But is Dr. Linger a good
Dr.
candidate?
Linger should be on there. Sure.
Okay. Dr. Linger, we might be pulling you in.
Good.
Dr. Gubler is, he's coming.
Okay.
Yeah, he's coming. Hello, everyone.
Hello, I forgot you said to be on 5 minutes early.
All right. Well, let's get started. Thanks for joining us. So the purpose of tonight's session, first of all, is to kick off Research Week. Woohoo! It's here, finally. We are ready for it. We are so excited. This year, we had our largest participation ever. We ended up accepting 192 students to present their abstracts. And of that 192, we selected 10 who we thought will be excellent oral presenters. So that's what you have to look forward to on actual research day. But the rest of the week, you have all sorts of other events. And a huge shout out and thank you to Emily Cox, who has our research coordinator, who has coordinated all of this. So tonight's panel is Dr. Ben Brooks, Dr. Dean Gubler, and Dr. Iseen Zapata. These are 3 individuals who really, they mentor a lot of research, they know the research process well, and so the goal for tonight is to talk through kind of the research process and to have you, oh, and Dr. Ross. I'm so sorry, Dr. Ross, I forgot you. Thank you for being here. Yes, and I will say that the reason that these individuals were chosen is they won our first annual research awards for the top mentors and the top researchers for the year for Colorado and Utah. So first of all, congratulations to them. So I'm going to start by showing you actually, I'll put the timeline at the end. I've created a quick student timeline of what it might look like for you to start a research process, but we'll put that at the end. And I want to start out by asking each one of our panelists to tell us a little bit about their research background and their mentoring background. Just tell us a little bit about your research. And it looks like Dr. Ben Brooks is the first on my screen, so I'm going to turn it over to him.
Well, thank you. I'm really excited to be here. So my research background is I have a PhD in molecular biology, and what that means is I spend a lot of time thinking about things that are smaller than cells, and so that's one of the things that I really enjoy doing with my time. But I also happen to be the clerkship director for the research elective for the 4th year students, and so I also very much enjoy mentoring students in their projects, and I think that's the most rewarding and enjoyable part of my job is I get to spend a lot of time talking about all kinds of just very exciting and interesting things throughout the entire spectrum of research in the medical field. So at this point, I'm into not quite as many as the other Dr. Brooks, but probably around 65 or 70 publications, give or take a few. And so I've done this a little bit. So I'll turn it back over to you.
Thank you. Thank you so much. And Dr. Ben Brooks actually won the Utah Research Mentor of the Year Award. So congratulations there. And so now we're going to jump over to Dr. David Ross. He's the next one on my screen, and he won the Colorado Research Excellence or Research Mentorship Award this year. So Dr. Ross.
Well, thank you, Dr. Brooks. I appreciate it. Nice to be here. So my background is maybe a little different. I did a residency and fellowship down at LSU in New Orleans and was interested in some research there, and did get a couple of publications there, and then numerous abstracts and posters, especially during my fellowship, on an animal research project that we were doing. When I left there, I went to a private practice, a very large community hospital system in Colorado Springs, working with about 25 other emergency physicians, most all of whom were very interested just in clinical medicine, and really weren't that interested too much in academics. But I was sort of an outlier in that group, and I was able over time to get, I don't know, 4 or 5 publications during that private practice experience, which was hard to do because we're not set up for that. And my partners were vaguely impressed. They sort of said, "Oh, good job," and then they next patient kind of thing. So that's kind of how it's all started for me. Since I've been at RVU, that fit in pretty well, and I have been involved in numerous projects at RVU, most of which have resulted in posters or abstracts. But we have, I don't know, 6 or 7 publications since I've been there, and various things. Some are ideas that students have come up with completely. Others are my ideas that I find students who are interested in that and they want to take that on, or a mix of both. And so I'm interested in that. I think there's a lot of other things to be concerned about in your academics besides research. And so it's an extra that can add a lot to an application, but it doesn't replace quality work in the curriculum and on the boards. So thanks.
Thanks, Dr. Ross. Dr. Zapata is next on my screen. Dr. Zapata won the Researcher of the Year award for the Colorado campus.
Thank you, Dr. Brooks. I'm very excited to be here. I'm very happy to have all these people right now listening to our stories. From my about my experience, I've been doing everything. I've always been working in research. Initially, when I started in the field of food science, working for the industry. Then, moved into animal science, specifically working in meat production. When I was working on that for my graduate students, I was doing a lot of proteomics, a lot of omics stuff, which wasn't one of the things that motivated me to go hard into statistics. When I got into statistics, I got some advice from some of the people in the Department of Statistics, saying that, once you start learning statistics is what you're going to be doing. And actually that was true. Most of the work that I continued doing after that was mostly doing numbers. And, after I finished my degree with that, I moved into working in the field of genomics. I was working for the military for a couple of years. We were working with combat dogs and cancer risk and PTSD risk in dogs. And after that, I got some good funding from, a nonprofit to continue some of that work. And then, got into RVU. In RVU, I've been doing a lot of different things since I have, a lot of the skills for doing epidemiology. Public health is one of the fields that I've been working very hard on. But I pretty much have collaborated with almost everybody in the university. So I'm very excited about that. And, in terms of, what is important is, always be creative. Being a scientist is like being an artist. You got to be creative. You got to have new ideas. You got to think about what is going to be your edge, what's going to be the difference from what the other things that have been done. And, I'm fortunate that I have polished my skills to achieve that. So I'm very excited of being here. I've been very excited to, working with Dr. Ross, working with Dr. Brooks, both of them. It's been excellent.
Thanks so much, Dr. Zapata. And we'll finish up with Dr. Gubler, who won the Researcher of the Year award for Colorado.
So I can tell you, research was never my intent. I don't even know that I really knew what it was. But in junior high science fair, there was a competition, and I am competitive. And so when there was an award for that, I figured out that I needed to win the award. So I did that and then took 15 years off. And then when I was in college, I wanted some money. So I started working in an endocrine lab as a job. And then I found out to graduate in biology, I had to do original research. So I carried on my endocrine work for long enough to graduate, and then took a few more years hiatus until my fellowship. And I should say, I was required in my residency to do a couple of projects. I was the only resident in the cohort that actually wanted to do the research project. Everybody else, they thought it took them out of the operating room and they weren't particularly interested. So I played with it. But for my fellowship, I was required to get an MPH and to do a thesis. And all of a sudden, the lights came on and I got turned on to research. And just by the nature of the way the Navy is, when you have a unique skill, a relatively unique skill, they jointly assigned me to an epidemiology research unit in addition to my assignment at Naval Hospital San Diego. And from that, I was head of the IRB and doing my own original research and met collaborators all over the country. And once you start publishing things that are meaningful, all of a sudden, it's like Christmas. And I just kept doing it. And part of that was working with students and residents and guiding them through a process that I continued for 30 or 10 years, additional years in the Navy, and then 20 years in the civilian world. And it's a hobby of mine now. I love it. I like research design, and I like to see young investigators get excited.
Thanks, Dr. Gubler. So that's your panelists. I would invite you to, if you feel comfortable, turn on your cameras. I love seeing your faces. And this is your time to ask this panel of experts what it takes to do research at RVU. In order to prompt some of your thoughts, one of the things that I have recently done when I was up teaching a research class at MCOM is I created this timeline. And I don't know why I'm getting feedback here. Okay. So I'm going to show you this timeline. So you can see that here's the timeline that I've kind of come up with for the RVU research process. You come up with an idea, you search the literature, you choose your mentor, you design a study, recruit a team, obtain the regulatory approvals, perform the research, and disseminate the results. And ideally, this is how it works. And I put it on this kind of a timeline because it makes you think that it's all so nice and it just goes this way. And it very rarely is this direct and goes this easily. So my first question for each of our panelists, and feel free to throw a question in the chat if you want, or raise your electronic hand and we'll get to you, because again, this is your time to ask this panel of experts how to do this. But while you are thinking of questions, my first question for each one of our panelists is, tell me about the hardest research project you've ever done, the hardest one that you were able to push through. Now I will tell you that our panelists they all look somewhat puzzled as soon as I ask this question, because they are doing my favorite kind of scientific panel, the kind where it's kind of impromptu and you don't really know what you're going to be asked. And so you can see Dr. Ben Brooks giving me a grimace. You can see Dr. Zapati's like, oh yeah, I know which one I'm thinking of. Dr. Gubler, well, let me tell you, as you're each thinking about that, let me tell you about my 10-year research project, you guys. I had a project that took me 10 years to publish. We got all of the work done in 2 years. And it was so novel because we couldn't, and essentially what it was is we genetically engineered spider silk. You guys, I always have to slip that spider silk in here. We genetically engineered spider silk with an element, an amino acid element that grabbed heparin from the bloodstream. Now, if you remember what heparin does, it helps prevent blood clots. Well, it turns out that this little element that grabs heparin to prevent blood clots also looks like an antimicrobial peptide. And so we figured out if we did it at the right ratio, we could prevent blood clots and we could prevent infection at the same time. So we proved it, like we did all the right controls, and it was so difficult for the reviewers to understand. I kept getting these comments that would come back and they'd be like, we're not sure. So we would go further and we would do more. And it took us so long. And finally, we were able to get it published, but it took dogged perseverance. So I want to hear stories from our panelists about the dogged perseverance that their research projects have taken. Because sometimes I just showed you that straight line that makes it look all happy and all easy, but there are several pitfalls along the way. So I think I'm going to start with Dr. Zapata first. Dr. Zapata, you seemed the least concerned by that question, so I'm going to turn it over to you first.
Yeah, when you talk about what is the hardest, there are stuff that are hard because of the technical aspects. Sometimes you have ideas that are difficult to pull out because it just requires that you come up with something very novel or something that is, you had to cook it all the way from the beginning. But in my opinion, I would say the hardest projects are those when you have to deal with people that not necessarily have the best interest. And I had challenges like that. A lot of the research you do is going to be done with collaborators. And one of the things I always try to teach, and some of my students in the research elective, I probably have told them too many times, is that research is done by people. And people are weird, they're special, they have their quirks. So sometimes understanding where they come from, what are the interests, sometimes that's the challenge. If you want to make something happen, you need to work with that. And going to a specific example, I had a story. When I was doing my first job with the military, we were working with the army, and one of the biggest challenges with that was that we had to convince two agencies that they didn't talk with each other. So we were working on a project, we were collecting samples. Suddenly the program was moved to a different base, which was under somebody else's jurisdiction. And suddenly we didn't have clearance. So we had to work with other persons to get that clearance. And when we weren't there, it was a lot of understanding now their mission. It was a different mission. So we pretty much have to readapt a lot of the things we were doing for the project so it could fit that. So that was a big challenge because, we were ready to work. The technical side was solved, but, that the human side, that was the big thing that was difficult. And I think it was a great, valuable learning lesson. I learned a lot about, being flexible and having some capacity to be adaptable.
Thank you, Dr. Zapata. That is a great example of the challenges that can sometimes come with collaboration. Dr. Gubler, what do you think?
Well, the reason I was making faces when you said the challenge or hardest or whatever, my first response is I didn't have any that were hard. And that's I just don't look at it as hard. I look at it as opportunities, challenges, and, kind of a mountain to climb over. But one of the ones that was the most complex was very similar in that it had more to do about the environment than it did about the study itself. And I was a PI on a blood substitute that was multi-international or multi-institutional, multi-state for hemorrhagic shock. And for a study like that, you have to get community consent, which is a delayed consent because patients are too sick to get true consent. Just by definition, they're coerced. And so you get the community consent, And then people can opt in or opt out of the study by wearing some kind of an identifier. But within any community, there's very, very different, diverse interests. And so to try to get a community to consent and go to all of those special groups out there and lay out the research, answer all the questions, and do it in a way that you uniformly provide the information that allows them to make knowledgeable decision for their community as a whole. That was a true challenge, but it also made me very spiritual, because I had one of the harder communities of the multiple institutions that were involved, and we never got through the process. It actually got stopped by the state medical or the state public health officer because he didn't like it, regardless of everybody giving consent. And the first safety evaluation, the safety board shut down the study because it had an unpredictable mortality for those that received the artificial substitute. So spiritually, I was saved by a power bigger than me that kept me from enrolling a single patient.
Wow, that is quite the story. Thank you for sharing. Let's go to Dr. Ben Brooks.
So mine was just a story of buy-in in the community. One of my good friends, Gary Cohen, who works at Penn and has so for probably at this point, probably 50 or 60 years, not exaggerating. He and I came up with an idea, and it took a very long time for the scientific community to buy in. We've published probably at this point, probably 5 or 6 really important. We designed an instrument that drug companies use to screen antibody-based therapeutics. And we were trying to get it to be implemented in vaccine research. And right before COVID, actually, Drew Weissman jumped on board and decided to endorse but that was after 7 years of very difficult and tedious and lots of publications. And it was definitely one of those situations where we had to row uphill. I'm mixing my metaphors to get to where we wanted to go. So that was definitely my hardest one, but it's also been the most rewarding across time, because it's definitely seen impacts through the COVID epidemic. We saw significant impacts, and I think will be useful for many of the emerging vaccines that both Pfizer and Moderna are using, so or developing.
Thank you. I love that message. Sometimes the most challenging projects are the most rewarding. Dr. Ross, go ahead.
Well, I was, unlike Dr. Gubler, I've had some serious challenges, and I had debate about which to tell you about. I will just briefly say that I had one project. It wasn't 10 years, but it was 6 years. And it was based on a grant that we had originally received for a pediatric study that we couldn't actually figure out in the end when we had the money what we wanted to study. That was part of it. But anyway, it dragged on with multiple authors for 6 years. But the other study that I think probably was tougher and I'm probably most proud of in the end is a study that we actually started. It wasn't a study initially, it was a QI project, and it became a study. We started collecting data in 2003, and it was finally published in 2012. And it, again, because I was in a private practice, non-academic setting, it was extremely difficult to do. And there was really 2 other authors besides myself. We battled very, very long and hard to get the data we needed and to analyze it in different ways, and to make it palatable and readable. And it had to do with a very significant question, which was, could paramedics and EMTs identify chronic inebriates, alcoholics in the field, and take them directly to a detox center and bypass a hospital? Because in the past, and probably still currently, a lot of inebriates on the street, when they're not responding or somebody's worried about them and they call 911, they go straight to the ER. and they are there for hours, and that can be a problem bed-wise and everything else. But you also don't want to miss occult injury or illness. So anyway, we identified a strategy to do that, and then we followed the patients that went to detox and those that fell out of the protocol and had to come to the hospital. Anyway, that was just a huge undertaking. It got published in Annals of Emergency Medicine, which is, in the emergency medicine world, the flagship journal. That is, it's by no means the New England Journal of Medicine, but in the emergency medicine world, that's kind of the top journal, and it's extremely hard to get articles in there. And then after cap it all, I thought we were done. We got a letter written to us that had questions and comments from a toxicology group that was published in the Annals of Emergency Medicine. And they correctly pointed out we had the wrong units on our breathalyzer tests. So after all of that, we had to admit that instead of grams per deciliter, it was milligrams, or we had milligrams per deciliter. It should have been grams per deciliter. And nobody caught it, despite 3 different revisions. And certainly we didn't catch it either. Anyway, so that was very aggravating, and I had to write a letter back to Annals and explain that, and they actually published an erratum, which was kind of a drag.
I've never had that happen, anything like that ever.
Yeah.
To Ross.
I see. Okay,
Yeah.
good. That's why you're so much smarter than me. That's
Thank you all so much for sharing those experiences. I think it's important, students, to realize that research is not an easy thing to do, and it takes perseverance, and it takes a lot to actually get what you want out of it. But it's also a great opportunity to kind of do the things that you want to do and connect with a network and connect with faculty, particularly here at RVU, that share your interests. So while you're thinking of more questions, and feel free to throw questions in the chat or just unmute yourself and ask, but we're going to continue our conversation. And I'm going to ask.
Can I ask a question or discuss something real quick?
Yes,
on
absolutely.
Your timeline, because I think it's a really great timeline. Well, I'll just make 2 quick points on your timeline. A lot of times we just think that this is just, especially some of the med students that may not have as much experience with research, think that this is just a 3-4 month process and that everything magical will happen. And the truth is that sometimes these projects will take years to get done. And oftentimes I see the students in the 4th year and they come in, and I'm sure Dr. Small and Dr. Ross, who also mentor, will say the same thing. They'll show up and we've got 3 months to ERAS applications being done, and people feel like they can get 3 to 6 publications done in that time frame, and it's just not real. And so I know I hope that there's some of you who are younger underclassmen, for lack of a better term, that will sit back and say, hey, look, this needs to start happening early. You don't spend insane amount of times, and there's times like, dedicated, that you're going to have to take some time off. But if you dedicate 3 to 5 hours a week across your entire medical education, it is realistic for you to start seeing some of these projects. And the other thing I'll just say is, it's really nice when you can work together. And that's one of the things that I love about RVU, is that students are absolutely willing to work together. In other environments that we've been in, it has not been the case. It's been ultra competitive, and this is my baby and you can't be involved in this and that and the other thing. And I think our students work really well together and help share the load and the burden across time. And things don't always work out, as you've heard from all of us, but if we all work together and we're rowing in the same direction and we start early and we start often, then things can work out. And your timeline does look real across multiple years, but not in 3 months.
Dr. Zapata, I saw you unmute, so go ahead and add.
Yes, now that Ben brought up, this diagram, one of the things I wanted to mention about this is that usually the ideas not necessarily come out of nothing. They come from what you see around you. And the way I would say it works really well in RVU is you first realize what is your capacity, what is the feasibility of things, what are the things that you have access to, and then you polish an idea. Because it's very common that I get students interested in ideas that are not feasible. So it's an excellent idea, but we don't have all the money, we don't have all the expertise, and in many cases, it's not because we are RBU, it's because that doesn't really exist. You need to form a team, and that is the only thing, when you come up with ideas, it just comes from what you see around you. And some of the students that I've seen that are the most productive, they're really good on paying attention to what is hanging around everywhere. So we can start like piecing out those things and putting them together into a project. Those projects usually are the ones that make it.
Thank you, Dr. Zapata. I think that's great advice, and that kind of goes to the searching the literature to figure out what's been done, what could you do. And I really want to focus in on this next step here. Ben Brooks talked a little bit more about about choosing and recruiting your team. One of the things that research allows you to do is show leadership by recruiting that team and working in that team environment. And I know you heard Dr. Zapata talked about the importance of collaboration and how it can be difficult, but that's where your leadership shows and really shines. But I want to focus in on choosing a mentor. So I'm going to stop sharing my screen now here again for a minute, but let's talk for a minute about choosing a mentor and how do you choose the right mentor? So I think that is a really interesting question. And as I'm going to go through, we've got some comments in the chat. So as I go through those, I'm going to ask each one of you to kind of talk about when you are accepting somebody to mentor. When a student comes to you and asks you to be their mentor, what are you looking for? What do you want them to have already done before you agree to sign on to that project? Dr. Zapata, I'm going to skip you because I know you've already talked a little bit about this. So I'm going to skip you till the end. But I really would like to hear from Dr. Ross because he has been very successful getting students all the way through these projects. Dr. Ross, how do you choose which students you want to mentor?
Well, I don't really have a strategy per se. I mean, I'll listen to anybody who wants to talk about research, whether they have their own idea, whether they have no idea or whatever. And so I'll listen to all that. Like I have a couple of meetings coming this week already with other people. And then I'll try to guide them a little bit and see, if we can kind of narrow down an idea, either something that we already have going that they can join or something ideally that they've created or that they can be involved in. And then you really have to judge the enthusiasm for it. How passionate really are they and how willing, and it's really interesting that you sort of see over time, maybe in 2 or 3 meetings, who really wants to who has the drive to push this through, at least to a poster, and who really doesn't, who's just kind of, maybe looking for a CV checkbox or something. And you can tell. And so ideally, I think the student I like to mentor is somebody who is committed to the concept. That means finding an interest that they can identify with, that they really want to know the answer to. And I certainly will help. And it's a mutual operation, but the student ultimately has to lead the way. I don't know if that helps, but clarify. But like I said in the chat, I think simpler ideas are better. Typically, if you get too complicated, you just can't answer any question. So honing that in is really important.
Yeah, thank you, Dr. Ross. I think that's great advice that goes directly to Joycelyn's question in the chat here about how do you narrow down those ideas and how do you really decide what you want to focus in on. And simpler is better, and figuring out what you can do as a medical student is important. Like you're not going to discover a new molecule. You're not going to do a bunch of wet lab work because you just don't have time. So figuring out what you can do and what you're interested in is critical. Ben, I'm going to jump over to you and ask you to answer that same question that Dr. Ross just answered about how do you decide what projects you want to mentor?
Well, I'll take anybody if they're excited about them, because what I think, and Dr. Ross probably is in the same boat as I am, if they're super passionate about it, I'm interested in it too. That's the fun part about what we do. So how do you pick a mentor? I would pick someone who's also has a shared interest. And there's some of us who are just interested in, if it's a shiny object, we're like, ooh, shiny object, let's go look at that and see, just are very curious people. there's other people who are very focused, and I think you just have to pick the right person for your personality. I think if you pick someone, oh, I know that Amanda, you're in the same boat. You're also interested in a lot of different things, and that is the number one thing that drives all this. I'll just concur with Dr. Ross. If you're excited about something, I'll go along with you, just because it's fun. It's fun and exciting to be working with people who are so. That's the youthful energy. That's the beauty of what this institution is. This institution is about the energy level that the young people have, and that's, for me, that's my only requirement for how I pick a project. If it's fun for all of us. So.
That's awesome. And you guys, just for students on the call, if you have not heard me say it, that is like my number one rule is research has got to be fun. It has to be rewarding for what you're doing. Otherwise, you're not going to want to do it, and you're not going to get anywhere with it.
Well, the other thing is there's 500 other distractions that you'll never make it. If you're not excited and interested about it, you'll never make it. It just doesn't work that way.
You're not going to get to the end. We started out talking about how difficult it can be. And if you're not excited about it and you're not passionate about it, you're not going to get to the end. Dr. Gubler, I'm going to ask you to answer the same question. How do you choose students you want to mentor?
I really don't have anything to add other than, for me, my door is open to anybody who expresses interest, and then they self-select. If they can't work through the process, they go away. And that's how I decide. I would never, ever tell somebody else that I wasn't going to help them. They choose. They make the decision.
Yeah, and that brings up the second principle, basically, that we keep talking about with research, is it has to be student-driven. We don't have enough faculty for each one of us to help drive student projects, and we really want it to be something that is, it serves you. It serves your purposes and what you want. Okay, Dr. Zapata, he has strong feelings about this one, you guys. So he's going to tell us about it, and I saved him for last on this particular question. Go ahead, Dr. Zapata.
Well, I have the same posture as Dr. Gubler. I don't turn people back. But when I say I don't turn people back, it doesn't mean I just give everything to everybody the same way. There's people that need some guidance in a different way that's more basic, rather than somebody who has a more technical necessity from my side. So exactly, the people that don't have it in them, they usually will disappear. But it's difficult to pick up who you want to keep working with, because you want to see results. You want to see something that progresses. And we got some students that just want to do check marks on their CV. I particularly don't like that, but I've seen some of them turn into something that is very well driven and make it very personal. There's a lot of people that have unrealistic ideas. So if my position doesn't persuade them to try to reconsider their ideas, maybe recommend them to go somewhere else to kind of get the same story. Things like that. And at the end, it's the people that actually have the capacity to do the stuff that they want to do. That's the one that I try to stick with.
That's great advice. So that really, students, what Dr. Zapata just said, should guide how you're choosing a mentor. Choose somebody who's going to challenge you and make you refine your ideas, because that's going to be the person who helps you. So it should be somebody who is passionate about helping you. And then I want to make sure we tackle the other part of Joycelyn's question about, and I'm going to change it a little bit, Joycelyn, so hopefully this gets at what you're talking about. Let's say a student is interested in potentially 2 different specializations. How can they use research to help them decide where they want to go, what they're wanting to do? And Ben, I'm going to throw that one to you first.
Yeah, this is a really important question, because this happens all the time in the third year, especially as students are on their rotations and they're starting to see and explore and, oh, hey, look, I thought I always wanted to be a surgeon, but guess what? I went to OB and I really loved OB. Or this happens with every specialty all the time. And one of the things that I always recommend students do, I'm so interested in everything, because that's me. Like I said, I mentioned earlier, I'm a shiny object person. I get excited. But you have to remember, you're going to be doing this for 30, 40, or more years. And so it really has to be something that floats your boat for long periods of time. And research can do this because the projects that you're going to do are not going to be an 8-week project and then you're done with them. If you can carry a project out to completion, it really shows that you're at least on the start of it. And what I recommend is that students pick the one they think they're the best at, that they're most interested in, and attack that. And research can facilitate whether you're in that mode or not, whether it's going to be the one that's actually going to be the one that carries you through your career. If you don't do that and you're wishy-washy about this one or that one, and I'm going to try multiple things, it actually will come to bite you because when you go to, get to ERAS point, everyone understands, hey, I was really interested in OB, and then I got into this research project and I discovered I didn't like it. So I switched projects, and now surgery is my preferred mode, and I love it. Everyone understands the switching story. What they don't understand is wishy-washy, right? They don't understand, well, I went from here to here to here to here to here. So if you pick something, and research can really help you identify which one is really going to help you and which one's going to be the one become your passion and your profession. So that's how I always advise students. And I think for the most part, that works out best for them in their interest.
Yeah, thank you, Dr. Ben Brooks. I appreciate that. Dr. Ross, I'm going to ask you to weigh in on this question too, because I've seen you do this really successfully with students to help them get the match that they want.
Well, I mean, I would say I was thinking about this as Ben was talking, but I actually don't think it's I wouldn't use a research project as a venue to choose a specialty or to help clarify. And the reason I say that is because practically speaking, at least in my experience at Rocky Vista, really students need to get going on a research project, if not in the first year, by the second year. And I've seen this in our ongoing projects that we have now, where third years just don't really have the time. And they're already on existing projects. We have the project in place, but if we were trying to get a project off the ground with a third year, I think that would be really challenging. I'm not saying it couldn't be done, but probably things are going to be sacrificed that shouldn't be sacrificed if you're doing that. And
Yeah.
fourth year, obviously the same. So I think people have to, bite the bullet and find a project that is interesting to them, kind of, without necessarily knowing what specialty you're headed to, and then see that to completion, as we've said. And that's probably worthwhile a lot more than trying to think about it as a way to pick a specialty, if that answers the question. And one other thing, I just like to come back to the previous comment about the mentors. I met with a group of students last year who were first years that had an idea for a project that I really just didn't think would work. I just didn't think it could work. It involved multiple hospitals, and I didn't think that it would fly. But I kept meeting with them, and I said that, and they kept working it, and I supported it, but I told them factually I just didn't think it would work. And finally, at the end of last year, they decided it wouldn't work. And at least two out of the three, I was able to put into an ongoing project, which they love, and now they're really flourishing in the second year. So I think that's also part of a mentor's job. So I'll just add that little piece.
Thank you, Dr. Ross. And I hope Dr. Zapata and Dr. Gubler will forgive me, but I'm not going to ask them for the answers to those questions, because I think there's a more important question that's been raised that I want to make sure that we discuss fully. Because I think that this is something that students often struggle with is, what if you don't know what your interests are? How do you get your feet wet in research when you don't even know what you don't know, and you don't know where to start? And Dr. Small raised this question in the chat to me, and I think it's super important that we talk about this, because there are some mechanisms. We've talked about, when you already have an idea, how you find that mentor, how you start, but what if you don't know? And so there are mechanisms at our view to do that as well. So let's talk for a little bit about some of those mechanisms. First, we have a Teams chat. If you're not on the Research Interest and Opportunities team, students, I would encourage you to do so, because when when anything comes across our desk about, a physician reaches out, says, hey, I need some students to do this, or a faculty needs students to help with the project, we post it there. So that's how to get kind of plugged into a project. And then one of the other things that Ben and I have been working on is a research marketplace, where we can have students sign up for ideas that need to be passed off. Because Dr. Small calls it, I love this, multi-generational teams. So you have ALMS 4 students that show leadership by mentoring ALMS 1 students. And you've got kind of this vertical integration of research ideas. And so you have perpetual research ideas. And that's what we're trying to build with the research marketplace, which I think is going relatively well. We've got a few students piloting it now, but I want to ask our panelists, and I'm going to start with Dr. Gubler, because in the military program, I think that this is a good example of how do you get plugged into a project, Dr. Gubler? How do you do that as a mentor, put students into projects, and how do students find that?
Well, that wasn't exactly what I thought you were going to ask me, but I don't think it's so important that a student knows what they want to investigate. I'm okay if they start with world hunger. That's part of the role of a mentor, is to be able to sit down, talk with the student, and tease out the interest that they may not even know they have. And oftentimes you can come in with a very broad view of the world and leave with a project that's actually doable. And so I think that's key. But what we do in the military program, and I think it applies across the board, is I think you're starting in the wrong spot if you're saying, what research project will help me get the residency I want? People who are making the decisions about selections are less interested in the topic of the research paper. They're interested in the intellectual curiosity. And there's some safety to do a project that the specialty that you're applying for knows nothing about, because they'll be afraid to dig into it on your interview. But if it's something that they may know more about you, then you might set yourself up. And so it's the intellectual curiosity, and then picking a mentor or peers that know the right questions to ask you to help you figure out what it is you're really interested in, and you may surprise yourself. And if you're truly planning on a life of evidence-based medicine, it should be really easy to find a lot of things that you're curious about.
Yeah, that's fantastic. Thank you, Dr. Gubler, for that. I think that is a great thing to recognize, is that we are trying to develop, and part of our whole institutional goal for research is to develop you as critical thinkers. So not that you will always know the answer, but you will at least know how to seek it out, and how to seek advice. Dr. Zapata, you want to weigh in on that?
Yes, I just have a fun story about something like that. You guys don't do it here for your medical degree, but if you get a PhD, you gotta go to defend your dissertation. And one of the advices I give to other people that are doing that is, understand your committee, understand the members that are going to be asking you stuff, because if you make them fight each other, they don't fight you. And I remember that example. I was defending my thesis. I had one statistician in my committee, and one of the other persons was a molecular biologist. He was an histology expert, and the way they see the world is completely different. So suddenly I triggered one to say that, when I do histology, statistics don't matter. And then the other one jumped, and you just pull out your popcorn and just watch it happen. So it is a strategy, and at the end, it's about people.
It's about people. I love that, Dr. Zapata. Thank you for sharing that story.
Yes, we
and
used
that's
to do that all the time too. We would we would take things
Plant
out of slides
Yeah.
so that we would know, because Dr. Jarvis was going to ask you that question. And so then you looked really smart when you just all of a sudden went to the next slide and there it was, the answer to his question. Oh yeah, I'm going to get to that. Here it is.
So,
And that same thing is, when we apply for grants for agencies, we understand their quirks. When we go ask for permission for using certain data, we understand what they want. So you can polish all those requests. You can make a plan on how to approach those things.
and Dr. Zapata, the reason why I love what you're talking about so much is because students, you have to realize that you can create a mentorship team. So if you want Dr. Gubler, because he's got one part of the expertise, but hey, Dr. Gubler's not super great at this other part, well, yeah, then pull Dr. Small in at that part. So you can create a mentorship team. But let's talk for a minute, and I think this will probably be our last question before we'll end the session. How do you have a breakup conversation with your mentor? So let's say a student, Dr. Ross, you're laughing at me, but this is an important question that students come to me with because they're trying to learn critical thinking and team dynamics. And those are two important things that I want them to get out of our research program. But let's say that it is not working out with your mentor. How do you have the breakup conversation? Dr. Ross, you want to start with that one?
Wow. Well, the students wouldn't know who the heck I'm talking about, but I'm thinking of Neil Sedaka. There's a song called "Breaking Up is Hard to Do." That's what I thought of. But anyway, that's ancient history, folks. I right, wrong, or indifferent, I haven't had that happen to me, but I would hopefully, have people say, it's just tell the mentor, I just don't think our interests are mutually aligned. For example, if somebody really wanted more of a basic science emphasis in their research, I am not the right person. And if it took a couple of meetings with me to figure out that I'm not, I may have already said that, but they might decide, yeah, I need to go talk to Dr. Riznar, or I need to talk to Dr. Brooks's or somebody else, to really get guidance, and hopefully would mutually arrive at that. So I think just like any of our other interactions, just have a meeting and be honest about the fact that it's probably not working out and that there needs to be a change. And I think rather than just not showing up and we wonder what the heck happened to you and stuff like that, that would be nice. And I've had a couple of, not breaking up, but I've had a couple of projects where we got IRB approval and it just has gone nowhere. And it's not really the student's fault. It's just some mutual things have come up. And even though we have IRB approval, it's not going to take place unless they come up with a different. So it's sort of like that anyway.
Yeah. Yeah. No, thank you, Dr. Ross. I think that that's really great advice is to, that is one of the things that we're trying to teach you is how to be a professional, and breakup conversations are sometimes part of being a professional. Dr. Gubler, I'm going to throw that question to you.
Well, to me, it's very straightforward. Honesty is the best policy. If it isn't working, it isn't working. Have the maturity, go and just have the conversation. I can tell you, though, how one of my teams did it. They came in as a group and they were all excited. And they said, we added to our hypothesis and we got accepted to Shark Tank, and fired me. And I asked them, why are you firing me? And they said, because they have money. So they went for the money and sold me out.
So that's another way to do it. That's another way to do it. Dr. Zapata, do you have any suggestions?
Sure, I would just highlight that sometimes the people that are mentoring you not necessarily have a formal agreement with you.
Yeah.
So it depends. It depends what type of mentoring relationship you have. There are some places where just like moving to the next step, just finishing what you're doing is enough. There are some others where you need to have a conversation, and there are some others where you need to run away. It depends, again, it's about people, and sometimes, people have their own way or proceeding. And even if you want to proceed the correct way, it will not necessarily work. So you need to understand that you also are limited, when you're dealing with somebody else.
Yeah. Ben?
Yeah, I think because research at RVU is student driven, I think all of us should be aware that there's probably, I mean, I send people to Dr. Zapata probably 6 times a week, right? You see, so I don't think that there's like, this is not for me a big deal. If students want to go work with someone better looking, almost everybody, then that's fine. If they think I smell bad, whatever the reason is, it's their project and you're the one in charge. That's how I look at it. And so I would just, if you own the project, then I think that's, you have to do what's in the best interest of your project. And, we just seek out the expertise. It doesn't mean you have to try to fire someone either. You could just bring other people onto the team. Like I said, we work all the time. I mean, I've worked with everybody on this panel on different projects with different students, and we've come and gone, and that's just the name of the game at RVU. And because I don't have as much clinical experience, but so I sent him to Dr. Ross. I don't have the biostats, so I sent him to Dr. Spada. That is the quintessential element of a good research project. It's just working together with everybody, and Dr. Gubler has the MPH. And Dr. Small and I work on projects with micro on staff and Pseudomonas. And I said, hey, I need the help on this. And so I think just by having those conversations where we all know that we need to work together and working with teams of people who have different expertise, then I don't think I would never be offended by if someone said, hey, you smell bad and it's time to go work with Dr. Ross. I think I'd be like, hey, go for it. I think he's a great guy, great mentor. So.
And thank you so much. I think that is a beautiful kind of last sentiment to this, is that this is how a research team works. Certain people, you want people who have complementary expertises. You want to plug into some ideas. You want to find research mentors who are going to teach you how to critically think. And it's more important about that. And then you also need to find out where to go to seek advice when you're trying to figure out how to navigate tricky situations, particularly tricky team situations. Your mentor is really important there. And Dr. Small put a comment in the chat, and I would like him to just kind of end the panel with that comment about what is his role in all of this?
Yeah, I like the structure of your algorithm, but it doesn't always work that way. And, all of those elements are needed, but not necessarily in that order. And sometimes the right order is I'm walking down the hall and a student's typing away at their computer and they start asking me questions about things. And, I've referred people to the pharmacology folks, immunology folks, molecular biology folks. I don't have any ownership in, I've got to grab all the best students I can and hug them to myself. My role is to help process through it. If there's any piece of advice I would say to all the students here is, if you have accidentally felt scared by all of the things that we've talked about here, ignore it and come talk to one of us about what's on your mind, what you're thinking about. I've had students just approach me and say, hey, I want to write about, language skills in patients in clinics. And I think, well, I speak 4 languages, so what the hell? I'll help you with that one. Or I might pass them on to somebody else. And it's an exploration process. But don't feel intimidated that you don't have beautifully thought out hypothesis plan with a budget before you come in and start talking to one of us. We don't expect that from a first or second or third year medical student. What we want is somebody to come in and say, hey, tell me, what's going on with it? I'm really curious about something, whatever it is. Even if it's, I'm curious about the research project, I have no clue even what project I want to work on. Okay, come talk to us. That is where I would like to leave you.
Thank you, Dr. Small. I think that that is a perfect way to leave us, and I appreciate that advice. Above all, research should be fun. It should excite you. At RVU, we are here to help you and to serve you. And I'd like to thank Dr. Forstein for being on this and give him the opportunity to make any final comments. Will I write this one last chat response, and then we'll let everybody get off to the rest of their evening. Dr. Forstein, go ahead.
Thanks, Dr. Brooks. First, I want to thank the panelists. There was a couple of 100 years worth of wisdom dished out tonight on the panel. I want to thank the other faculty members who are here and the students who hung in there. I too have been a research mentor here at RVU, and my door is always open and happy to help any student with their project. I am sitting on 49 publications, so I do need some student to bring me a good project so I can get to 50. That would be very exciting. I published a paper last year with a group of students, and that was exciting. Everything you heard today is right on. I will tell you one thing about my perspective as a residency program director in research. So what we were interested in was, did a student do research in medical school? So that was worth something. And did they get something published in medical school? That was worth a lot, because it's hard to get something published in medical school. But we were interested in students who could get a project like that across the line. We didn't care if it was OBGYN. That wasn't what was important. It was, did you have project or projects? And could you speak cogently about them in an interview? Could you talk about the project and tell us what your role was? So I think that's important. If you look at the NRMP data book and you look at the students who matched in a specialty versus the students who didn't match, there are a couple of things that distinguish them, but typically the number of research experiences is not it. Now, they don't ask about publications, they ask about research experiences. But you'll see in OBGYN, the average student had 3.4 research experiences who matched, and the average student who didn't match had 3.2. And in psychiatry, it might be reversed in any given year. So it's not that that's going to make the difference necessarily, but it is helpful if you can speak about your research report in a cogent way at a residency interview. So I want to thank Dr. Amanda Brooks for putting this together. Have a great research week, everybody. And thanks for spending a little bit of your evening with Rocky Vista University.
Thanks, everyone. Had a great rest of your evening. See you all through the rest of the week.
Hey, Char. Nothing. I'm just finishing up at work. Okay. Okay. Good.